A word that is not the main nutrient of an animal, but is essential for maintaining its normal development and physiological function. A relatively small amount is required but not produced in the body. It is largely divided into water-soluble vitamins and fat-soluble vitamins, and a deficiency condition is unique. Some scholars believe that eating too much can have side effects. The presence of vitamins has been recognized empirically as food containing a lot of certain vitamins is effective for deficiency diseases in the event of a deficiency, but experiments have shown that natural foods in addition to carbohydrates, proteins, fats, and inorganic salts in the 19th century included some essential elements of life in natural diets, and in the early 20th century, they succeeded in chemically separating this ingredient, and thus combining it with the amine, vitallin, which is essential for life. When it was discovered that not all vitamins were amines, it became the current name vitamin, which dilutes the link between amines and vitamins. The common names of vitamins are in alphabetical order from A, but they suddenly skipped from E to K, where vitamin F was essential fatty acids, vitamin G, vitamin I was found to be riboflavin, or vitamin B2, vitamin H was found to be non-essential and the flavine of vitamin J was reclassified to B2. Since K, L1, L2, M, O, P, PP, Q, S, T and U have been named, but they have all been reclassified or discarded. In addition to vitamins, essential amino acids, essential fatty acids, and inorganic salts are essential, since in vivo synthesis is not up to the requirements, even if possible. Vitamins can be largely divided into fat-soluble fat and water-soluble. A big difference is that fat-soluble vitamins are nutrients stored in the body, and when consumed excessively, they become hyperactive. On the other hand, water-soluble vitamins should be taken daily because they are not stored in the body. Fat-soluble vitamins, which include vitamins A, D, E, and K, are all essential to maintaining the body's different structure, characteristics, and functions in the body. Lack of fat-soluble vitamins does not show symptoms as long as you have no fat-free diet or digestion problems. However, they should be consumed properly because they accumulate in the body when they eat too much. A water-soluble vitamin belonging to the vitamin B complex and vitamin C. It has the property of melting in water and does not accumulate in the body even if it is consumed in large quantities. Since the rest of the water-soluble vitamins are excreted in urine through the kidneys, it is advisable to take only the necessary daily dose. Let's start with fat-soluble vitamins. Vitamin A. It acts as an antioxidant that strengthens the body's resistance and prevents cell oxidation. Protects mucous membranes of the mouth, airway, stomach, and intestines by promoting cell regeneration as growth factors of epithelial cells. It is also necessary to produce rosin, a photosensitive pigment that senses the light of an object. Foods that contain pork liver, old pumpkin, carrot, red paprika, sweet persimmon, green vegetables, and red pepper are included in the food. Lack results in night blindness, dry eyes, and amnesia. Overuse can cause headaches, skin dryness, and itching. Vitamin D. Vitamin D, which is mostly obtained through sunlight, accumulates absorbed calcium in the body in the bones and teeth, and helps to produce immune cells from the thymus. It is essential to calcify bones by helping resection calcium and phosphate in the kidneys, and also reduces the risk of cancer. Vitamin D enters the body and is absorbed by fat tissues, but fat tissues do not release vitamin D easily, making it easier for obese patients to lack vitamin D. Foods that contain herring, salmon, margarine, dried shiitake, tuna, butter, eggs, milk, and soy beverages. Lack results in multiple sclerosis, rickets, osteoporosis, and osteomalacia. Overuse can lead to mental development, vascular contraction, hypercalciemia, and hypercalciuria. Vitamin E. Vitamin E, which serves to maintain cell membranes, is effective in preventing and treating cancer by disabling free radicals with antioxidants. In addition, epidemiological surveys on prevention of cardiovascular disease showed that people with high intake of vitamin E had a low incidence of heart disease and also helped prevent diabetes. However, this was not a supplement but a food intake. It also helps reduce harmful LDL cholesterol levels, reduce risk of cardiovascular disease, prevent cataracts, promote wound healing, atopic dermatitis and arthritis. Foods that contain sunflower oil, sesame oil, pine nuts, almonds, peanuts, margarine, and shortening. Lack results in cell and muscle damage, inability to reproduce, anemia, muscular dystrophy, and neurological disorders. Overuse can cause headaches, chronic fatigue, gastrointestinal problems, reduced platelet clots, and muscle weakness. Vitamin K. Vitamin K is abundant in animal and vegetable foods, so it is generally difficult to find deficiency diseases in healthy people. An important function of vitamin K is that blood clotting reactions can be identified and is necessary for the biocompatibility of certain proteins found in plasma, bone, and kidney. Foods that contain leeks, crown daisies, spinach, cabbage, raw seaweed, beans, eggs, green tea, fruits, grains, milk, and meat. Lack results in Crohn's disease, delayed blood clotting, intestinal disorders, and abnormal activity of intestinal bacteria. Overuse can lead to liver, intestines, and leprosy, hemolytic anemia, and hyperbilirubinemia. Now let's look at water-soluble vitamins. Vitamin C. Vitamin C, which protects the body from free radicals, prevents cancer and arteriosclerosis and strengthens the immune system. Vitamin C also inhibits the reproduction of Helicobacter pylori, which is the cause of gastric and duodenal ulcers, helps the elderly maintain cognitive and memory, and is also effective in preventing Alzheimer's disease. Participate in the formation of connective and supporting tissues to protect the health of the skin and gums and promote damaged skin regeneration along with protection of the skin from ultraviolet rays, thus inhibiting melanin pigment and relieving the palate and freckles. It is recommended to take pure vitamin C as much as possible when taking vitamin C products, and it is recommended to take it with or after meals. Foods that contain strawberry, lemon, green pepper, paprika, citrus, broccoli, spinach, and lotus root are included in the food. Lack results in scurvy, chronic fatigue, digestive problems, and depression. Overuse can lead to frequent urination, anxiety, headache, diarrhea, stomachache, sleep disorders, osteoporosis and hypoglycemia. Vitamin B2. Vitamin B2, also called riboflavin, is a yellowish crystalline substance called ribose and is called this. Eating a diet deficient in vitamin B2 for about 2 months produces deficiency symptoms, and early symptoms are inflammation of the mouth and tongue. Vitamin B2 has a limited absorption capacity and is excreted through urine at a rapid rate. Therefore, the toxicity from overeating rarely appears. Foods that contain mackerel, liver, mushrooms, enoki mushrooms, chicken, spinach, dairy products, eggs, and green vegetables are included in the food. Lack results in fatigue, anemia, depression, diarrhea, constipation, and reduced vision. Overuse can cause liver damage and skin redness. Vitamin M. Combined with vitamin M, vitamin B12, which is an essential nutrient for amino and nucleic acid synthesis, it promotes the secretion of noradrenaline as a vitamin that greatly contributes to growth development and red blood cell production. It plays an important role in cell division and growth by being involved in the cloning of DNA, a nucleic acid that makes genes. Foods that contain spinach, broccoli, braccos, mugwort, bean sprouts, peaches, oranges, and nuts are included in the food. Lack results in anemia, low-weight childbirth, premature birth, stillbirth, neural tube defect, malformations. Overuse can cause nerve damage and vitamin B12 deficiency. All vitamins and other nutrients are taken with the meal. Vitamin supplements should be taken immediately after meals or during meals, and since there is a good time in the body, they are advised to share rather than finish the dose for one day at a time. Let's think about what vitamins and nutrients mean. Some say that if taken during the day, water-soluble vitamins should be taken at night because they are used in urine or sweat, but since they support body use and metabolism of the 3 major types of nutrition, there is no big problem with eating them during the day or at night. Eating vitamins in moderation is good, but eating too much is bad